Atrial fibrillation is the erratic quivering and twitching of the atria. It is due to multiple ectopic foci in the atria. It is a sign of irritability in the atria, and as you see on the screen at this point, it gives no distinct P wave, but rather a wavy line with intermittent QRS complexes that appear relatively normal. Atrial fibrillation results in no coordination between the atria and the ventricle, and the actual heart rate of the ventricle is determined by the AV node. Since the signal passes through the AV node normally, the QRS shape may be normal, but the ventricular rhythm may be normal or abnormal. As a new finding, atrial fibrillation should be a cause to discontinue exercise. However, if atrial fibrillation is a chronic state and the heart rate's less than 100, then it has a minor effect on cardiac output and rehabilitation potential is good. If atrial fibrillation starts with the onset of exercise, there's a decrease in the cardiac output, an increased risk of symptoms, and an increased risk of an adverse event. As a result, a new finding of atrial fibrillation should be caused to discontinue physical activity at that point in time, and you should return the patient to bed. Premature ventricular contractions are also known as PVCs. They're large, long-duration QRS-like complexes with an abnormal shape that clearly distinguish them from a normal QRS complex. PVCs are a sign of ventricular irritability, usually related to ischemia in the ventricles. It is often an ominous sign since there's little or no cardiac output with each PVCs. PVCs are often benign and of low concern when they occur less than 6 times per minute in an individual who normally has these. Less than 6 PVCs per minute are often seen in normal individuals who are exercising at high heart rates. These PVCs are often chronic in nature and don't change with activity. PVCs are much more cause for concern in the following situations. Number 1, if documented ischemic heart disease is present, PVCs signify an elevated risk of MI and sudden death. If PVCs occur more than 6 times per minute at rest or during physical activity, there's cause for concern. If PVCs develop at low heart rates or with the onset of activity, you have cause for concern. PVCs that change in shape or number with the onset of activity are problematic. PVCs may occur in pairs or runs of 3 or more, and those are also cause for concern. Of considerable concern is the development of multifocal PVCs, meaning more than one focus is generating the PVCs. These are indicated by PVCs occurring in more than one shape. This indicates more than one irritable ischemic spot in the heart. Regardless, as a new finding, PVCs should be caused to discontinue the exercise. You see on the screen before you now an example of ST segment depression. I want to remind you that ST segment depression consists of a horizontal or downward sloping ST segment that's depressed for at least 1 millimeter or more and has a depressed duration of greater than 0.08 seconds or 2 small boxes if those were on the screen. The depth and duration of depression is proportional to the degree of ischemia that the ST segment signifies. As a new finding, ST segment depression should be caused to discontinue the physical activity you're currently involved in. All of this information is based on the following assumptions. The ST segment was isoelectric at rest and became depressed during the activity. Assumption number 2, there was an absence of cardiac medication that would alter the response to testing. Such a medication would be digoxin. The third assumption is the absence of metabolic abnormalities during the testing, such as hypokalemia. If these 3 assumptions are correct and you see a horizontal or downward sloping ST segment as a new finding, that should be caused to discontinue the activity. Oximetry is used to determine the number of hemoglobin sites that are bound to oxygen. Normally, the SO2 saturation is about 98 to 99%, meaning 98 to 99% of the available oxygen sites are clearly oxygenated. You'll note on the monitor that this value frequently fluctuates 1 to 2%. However, SO2 levels are cause for concern in the following instances. Number one, a drop of 3% or more in the SO2 level is cause for concern and reason to discontinue physical activity. In addition, an SO2 level that's below 90% is cause to not continue activity or to discontinue the activity even if the drop is less than 3%. This is because there's too little oxygen carrying capacity for the brain and other vital organs, and there is an elevated risk of an adverse event. As a result, if the SO2 saturation level drops below 90% at any point in time, or the subject experiences a drop in the SO2 of 3% or more, whatever physical activity is occurring should be discontinued at this point in time.
Orthostatic hypotension is a condition used to describe a decrease in blood pressure when moving into an upright position from a supine position. It is accompanied by symptoms associated with dizziness or lightheadedness. Orthostatic hypotension is the result of a decrease in systolic blood pressure of 10 to 20 millimeters of mercury or more, or a decrease in diastolic blood pressure of 10 millimeters of mercury or more, either condition occurring within 3 minutes of standing. When a person is lying down, the blood volume is distributed evenly throughout the body. However, when standing up, gravity causes a shift of the blood to occur from the upper to the lower part of the body. This causes a decrease in venous return and cardiac output, resulting in a decrease in blood pressure. The decrease in blood pressure results in a diminished blood flow to the brain and results in the onset of lightheadedness or dizziness. Normally, the systolic blood pressure should stay constant, with a slight increase in diastolic blood pressure occurring when moving to an upright position from supine. Those changes result in no change in blood flow to the brain, and hence no symptoms of dizziness or lightheadedness. Regardless of a patient's presenting blood pressure, there are general guidelines for when to continue or stop therapy based on the amount of change a patient's blood pressure undergoes during activity. When a patient begins therapy or exercise, there should be essentially no change in the diastolic blood pressure. An increase of greater than or equal to 10 millimeters of mercury is reason to hold therapy, wait to see if the patient stabilizes, and returns to safe blood pressure limits before proceeding with or discontinuing their therapy for that session. In contrast, systolic blood pressure is considered normal if it increases 8 to 10 millimeters of mercury per MET level of activity the patient is participating in, regardless of where they started. Bed exercises should be considered to be no more than 2 MET levels. As a result, any change greater than 10 millimeters of mercury with bed exercises, or a delayed response in which there is no increase in systolic blood pressure with bed exercise, should be considered an abnormal response and would be a reason to cease therapy at that time.